This segment, I'm going to be describing what you can do out of the 7 categories that can be done to deal with chronic pain and inflammation without going to medication. And by the way, we're not saying we shouldn't be using medication. We're saying we should be using everything, and especially the more natural things first before we go to pharmaceuticals. So in the first category, which is the environment, of course you want to avoid things that can chronically cause inflammation, like chemicals, and you need to really see what chemicals you're exposed to if you have a chronic inflammatory disease, including arthritis. So that's number one. Avoid toxins. A lot of folks don't realize that pathogens can be toxic as well. For example, if you have a chronic tooth infection, it's a tiny little infection that you may not even know exists, but the bacteria can be throwing out toxins that can cause ongoing infections. Chronic sinusitis, another one, for example, that can cause ongoing problems. Number 2, diet. Of course, when you're talking about diet and inflammation, diet is key to inflammation, and very few people ever talk about altering your diet to control chronic pain. And when you look at how diet affects inflammation, it's almost nonsensical that you don't look at it, because the things that can contribute to chronic pain and inflammation in diet includes, for example, high insulin levels contribute to chronic pain. Obesity, of course, contributes to inflammation. High intake of omega-6 fats, such as especially arachidonic acid, contributes to high levels of the prostaglandins that cause pain. And how do we know this works? Aspirin works on blocking the conversion of arachidonic acid, which is found in animal products, to the pro-inflammatory prostaglandins that are mainly responsible for pain. So we know that works. Also, eating good fiber is important, because if you don't have enough good fiber, it affects the gut flora. And the gut flora has a profound effect in some cases on not only inflammation, but what some people will call leaky gut syndrome, which can contribute to inflammation. In addition to that, eating lots of foods that have anti-inflammatory effects can be really, really useful. For example, turmeric. Turmeric is used in curries, but also is known to have significant anti-inflammatory effects. Also, green tea. Green tea, is commonly consumed in Japan and China. Well, it has an anti-inflammatory effect to it. Cayenne pepper. Pepper can be used in food. It's got an anti-inflammatory, and things like ginger are also full of nutrients that can help to reduce inflammation. So these are just some examples of what can be done diet-wise to help reduce inflammation and chronic pain. And in fact, in our diet program, in 10 days, the chronic pain scores in general are reduced by almost 50% in our evaluation of people who have chronic pain. In the third area, we talk about lifestyle, and that's physical, mental, emotional, and spiritual aspects of health. Physical therapy is important in controlling chronic pain. Sometimes, for example, arthritis, sometimes part of it is just not moving. So exercise can contribute to controlling chronic pain. Also, a lot of folks have a component of their chronic pain that has to do with depression. If you don't move around, you kind of feel sluggish and pain can get to you. So aerobic exercise may also be important. And then mind-body medicine is also known to be helpful in chronic pain, as well as spiritual practices. Fourth area is herbs and supplements. I'll just give you a few herbs and supplements that are useful. Besides turmeric, curcumin is the active ingredient in curcumin. EGCG is the refined substance in green tea that's anti-inflammatory. And spirulina, which is useful and anti-inflammatory, the active ingredient is astaxanthin. And there's a supplement now called xanthicin, which is actually a form of astaxanthin that is absorbed 3 times better than most products that are on the market. The fifth area is energy medicine. Basically, you're trying to increase voltage in the body to increase healing. When healing occurs, chronic pain is reduced, and some of the modalities include things such as TENS units, LED, that's light emitting diodes, lasers, pulsed EMF. All of these have FDA approvals to some extent, including the biomodulator, and scalar energy, still under investigation but harmless, has lots of folks who say that that helps with chronic pain. The sixth area is physical therapy. Of course, physical therapy can be useful in chronic pain, including PT, chiropractic, osteopathic manipulation, lomi massage, and other modalities of that kind. They can actually help to control chronic pain, especially if there's a mechanical component to it. And then finally, the seventh area is hormone therapy. And the reason hormones can be important is if your hormones are really out of whack, in other words, for example, your thyroid is low, you can't produce the energy that your body needs to heal. So having optimized thyroid is important. Insulin is a hormone. If you keep shooting your insulin up with processed carbs, insulin actually can contribute to inflammation. Actually, other hormones, such as estrogen, progesterone, testosterone, these also may have some effect mainly on mood. Those are just some areas that can contribute to control of chronic pain. Okay, I'm running out of time.